All right, I'm giving it a minute to allow more participants to join in, but as we on our pre-call, I actually did remind us all this is the first webinar 2024, and what a webinar it will be, led by our very own Dr. Laura Lee Hall. A lot of people say we can't do this or that in the vaccine world, in any world, but she has some folks on here that you'll hear from that have been getting things done no matter what. So I just want to give you that big quick preview. Before I turn it over to Dr. Hall, I want to make sure that you know that we have a couple of things happening here at NNQF in general that we can have tons of folks, or we'd like tons of folks to participate in. On January 25th, we have our Cancer Care Equity Summit in Washington, D.C. I'll put links in the chat for that. And then, as you all know, historically, we will be having our annual National Summit on Health Disparities that will take place April 29th and 30th. I'll put information in the chat in that as well. Registration won't be open until next week. And then finally, during the summit, we have this opportunity to honor leaders in minority health. So there's a top 40 under 40 application. We started this in 2016 and now we're in 2024. And we've had a lot of great people come through that program that continue to do things, and not only with NMQF, but globally. And so we'd like to honor those leaders. So if you know anyone, please suggest to them to apply. And we'd love to see them in Washington, D.C. during our summit. And so with that, I gave you a few announcements, but I just really want us to focus on the work that Dr. Hall and her team are doing. And so I will turn it over to her.
Thank you so much, Brandon. And before I share my screen, I just want to do a shout out to Leslie and Chinny, who are on the call, who are on the SHC team, and they do such great work working with the speakers and others around the country. So kudos to Leslie and Chinny for their great work. Now let me kind of put my screen up here. And I'm in slideshow, everybody can see.
Yes.
So the first NMQF webinar of 2024 is really honoring a couple of things. First, Dr. King, and also 3 leaders who are at in the community actually getting flu vaccinations done for people who are underserved and diverse populations. So we're very excited to hear from them. I just wanted to honor Dr. King with this, I think, well-known quote. So we are embarking on this. It's not just a Friday, TGIF. It's not just a long weekend. It's an honoring of such a great man. I want to take a few minutes to just kind of paint the scenario. Flu is rampant. These are all from the CDC website today, and you can see the trends are all going up, and the CDC estimates that there's been at least 10 million illnesses in this 23-24 season, 110,000 hospitalizations, and 6,500 deaths so far this season. You can see here's our current year, this red line, and we are up there, huh? We're moving right up there in terms of outpatient visits for respiratory illnesses. And we know that it's not just the flu, right? We know RSV and COVID are complicating the picture as well. And there's almost nowhere you can go to avoid the flu at this point. And we have some deep high activity in the South, and really very high in most of the country. As I noted, COVID also is going up now, with hospitalizations increasing. I would also like to remind all of us that flu vaccine rates are pretty low, not even 50% for adults. And when you look at people of color, Black adults, Hispanic adults, American Indian and Alaskan Native adults, big gap, big disparity when compared to the white population, maybe historically wide. Here's vaccine coverage. So you see there's a lot of states that have a lot of work to do. And so we are lucky to have the folks we have on the call to talk about how we keep it going. I should say it's not too late by any means. Typically, flu is highest in January, February, and March. So there is time to get those numbers up. This shows you that, flu vaccination shots are down in almost every state from last year. We have some tools, our drive program for clinics, and you can click on this. You'll get the slides, so you can go to drive, shcdrive.org. Here's some other resources. Again, we'll share this with you that you can use to promote flu vaccination. But really, the point of this webinar is to hear from some amazing champions on the ground who are successfully promoting flu vaccination among underserved communities of color. How do they do it? So it's my honor and really joy to introduce our panelists. First, we have Susie Foley, who's the executive director of the Greenville Free Medical Clinic. I'll let you read her amazing bio here. Free and charitable clinics are doing the job of vaccinating our underserved and uninsured populations around the country. They are an amazing group of organizations, and we surveyed several who participated in a program last year, and they really know how to get out into the community and reach these populations. So Susie, thank you for being here and being able to share with us what you do. Dr. Latressa Gordon, who you see here, is another amazing individual. She's in Michigan, and she's an extremely accomplished person, and she's developed this patient navigation program with community members that I think all of us will learn a great deal about. So thank you, Dr. Gordon. And we have Gina Grumble, who is a pharmacist. Where would we be without pharmacists in terms of getting vaccinations done? You see here, she completed her postgraduate residency training at the Ohio State University. She's in Columbus, and we really look forward to hearing from Gina in terms of her work as a pharmacist in the community. And thank you, Gina, for being here today. I will just remind everyone, put your questions in the Q&A box. I would ask you to put your comments in too. So if you have a question, if you have a success story, put it in the Q&A, and we will have time at the end to answer and address those comments and questions. And anything we don't get to, we will follow up after this webinar. So I'm going to stop sharing here and turn it over to you, Susie.
Thank you so much. Give me just a second here to get my slides pulled up into slide mode. And you all see that?
Yes.
Okay, thank you. Well, I am very grateful for the opportunity to share some of the things that we're doing, just a little about our clinic. We are a free and charitable clinic. We are a true free clinic. 100% of our patients are low income and uninsured. And we are a state that did not expand Medicaid. So there certainly are over 20,000 in our county who qualify. We opened in 1987. I have been with the clinic for 24 years. So there has been a lot of growth in that time, including really an expansion beyond primary care and the urgent episodic care that was initially provided. We have an extensive oral health program. We have expanded a lot of our behavioral health services after COVID, and a dispensing pharmacy with about 40,000 prescriptions a year, all services provided to our patients at no cost. We have 3 satellite locations, and they are located throughout the county. This map here is a picture of our county. It's about 20 miles wide as the crow flies and about 60 miles long. So county residents are quite spread out, and sometimes transportation is a challenge also. We have about 2,500 unduplicated patients a year, and we are still volunteer based. We do have a staff nurse practitioner. We have a PA who is assigned here from one of our hospital partners. She's on their nickel, but assigned here full time. And we have lots of residency programs that rotate through, lots of student clinical rotations, including Furman University, Clemson University, MUSC. Greenville has a med school, University of South Carolina. There's lots of students that we're working on orienting the upcoming workforce to community service. And our hospitals are really our best friends. Of course, we're their best friends too, but they do provide diagnostics for our patients at no charge, and also the in-kind staffing that I mentioned. And probably other than COVID in the last couple of years, the biggest change is that after 35 years of using paper charts, we transitioned to partner with one of our hospitals and implement Epic in July of 2022. This was a painful process for us,
Yes, I
mainly
bet.
because of the volunteer aspect. Some come once a week, once a month, once a quarter, but it is giving us much better information, and really is a good move overall.
Susie, we had a comment that they're having a hard time hearing you. I don't know if you can increase the volume.
Okay.
That's much
Is
better.
that better? Okay.
Yeah.
Hold it up a little closer. How we started our work with equity was through the National Association, primarily, of free clinics. There has been a lot of discussion over the years that anecdotally we've known the quality of care provided, but we have not had any real solid data and comparable mechanism to be able to speak the same languages as private practices, hospitals, FQHCs. And so has been an effort to do that since 2017. We were one of the free clinics initially involved in that. And I'm very pleased to see that we are now moving forward with our state, that all of the clinics in South Carolina will soon be participating. The Roadmap to Health Equity is not just a quality and data initiative, but it is certainly the start of quality and data. We can't really start making any decisions and evidence-based until we have a credible data source. But once we do, we are able to stratify a lot of that information. We're able to then determine where some of the disparities and inequities are and be able to address that. And here we are 6 or 7 years later, and kind of seeing where we are in this whole initiative. There have been 50 pilot clinics across the country. We kind of wrestled through the first couple of years of working out the bugs of how we do this, and it's now expanding to even more free clinics in the country. It's nationwide. 28 states have been involved to date, and more almost every week or month. There are 15 clinical quality measures that are being tracked by free clinics that are in this project. One of them is flu vaccination rate. And so that is something that moving forward we'll be looking at and analyzing and determining additional strategies. But the equity part of this whole project really is breaking it down again and stratifying by what they call real, the race, ethnicity, and language differences, and gender. And in addition to just collecting data and having the information, it's been an effort for quality improvement. There have been a couple of different projects to drive that deeper and a little bit closer look at some of the initiatives, and certainly shared learning amongst the clinics. So in 2022, we reported data on 4 of those clinical measures. And we were very pleased that we were able to extract that data from Epic. We only had a half a year data, so it was 778 patients for that partial conversion and startup. But in hypertension control, we were at or above comparable patient populations, the Medicaid population, commercially insured, and frequently above the healthy people targets. In uncontrolled diabetes, which is one of those, it's better if it's lower, we were lower than the commercial insured population and the Medicaid population. And we've done a lot in mental health. So depression screening is one of the priority areas. And we do a depression screening every patient, every visit with follow-up if necessary. And then breast cancer screening and mammograms, we are doing quite well in. So we were kind of proud of looking at these results and saying, we're doing a pretty good job. You know, we're out there, we're doing what we need to be doing. However, we look a little closer to some of those disparities. And when we stratify that data, this is where the rubber meets the road. We see that our females, our patients who are women, are doing better in their blood pressure control, but not doing as well in their diabetes control. And we're trying to address, based on each of these situations, what's the best way to try to intervene and address that? You know, why would that be, and what can we do to try to provide better information? We look at it in ethnicity also, and then in the language barrier, whether they need an interpreter or not. It is encouraging to see that language is not as much of a barrier as it certainly could be. We have quite a few bilingual staff. We have several volunteer medical interpreters that we're, I think this data shows that we're doing an adequate job, of course, always room for improvement, in making sure that understanding primarily Spanish speaking is not a barrier to seeking care. But in each of these categories, each of these 3 measures, we do see that our African American population is not doing as well as the overall population. So that certainly gives us the opportunity for additional cultural information, addressing it. We have now a African American patient navigator and CHW, hoping to be able to connect and have that trust relationship, because that's really, I think, one of the real values of the free clinic is that patients, when they come here, this is their medical home. They are able to access a multitude of healthcare services, and they develop a relationship, whether it's with the diabetes educator, whether it's with the front desk, whether it's with their mental health counselor, a nurse, a pharmacist. That relationship is really what it's all about. Now, we talk about disparities in race, ethnicity, and language and gender, but certainly in our area, geography is just as critical. And I think it's a pretty powerful statement that it's a short distance to a wide gap. And we look at life expectancy, and Greenville, the city of Greenville, has done a wonderful job promoting themselves. We're on the top 5 list of places to live and the top 10 downtowns in the country. And, you know, there's lots of different kudos coming our way. But this little circle breakout area is the downtown area. And within that, you see that within neighborhoods, there still are significant gaps. One prime example is that in the 29605 zip code area, that Greenville Country Club is in that area, but also the Pleasant Valley neighborhood, which is one of the historically African-American significant communities in our area, within half a mile maybe. And to have that kind of short distance and a 10 to 15 year life expectancy gap shows that there still is a lot of work to be done in our area and to address so many disparities that occur. So specifically on flu vaccines, it's interesting to see the national data because South Carolina is not even doing as well as the national data. The overall in the last 4 years is below 30%. It's probably important to note here on this graph that this is the 23-24 is year to date. So perhaps we're not through yet vaccinating and that it hasn't dropped as much as it might look like it is right now, that there still is opportunity for additional vaccination over the next 3 months of this season. But it's encouraging for us to look at the seniors 65 or above. It is improving. I think there has been probably good educational information, Medicare coverage for seniors who are now aware of the vaccines, the RSV, the COVID, flu, pneumonia that are available to them, and getting more of a push and an encouragement from their providers. But you see that in our patient population in age 19 to 64, it's below 20%. And that is not certainly where we want to see it, and gives us lots of room for improvement. Amongst our patient population, this year we were given from the health department about 250 doses. Some patients do get it other locations. We've had a couple of flu vaccine clinics, and we are currently out. We actually ran out in November, and I'm hoping that the health department will replenish our supply because I think we can continue to give vaccines if we do have that supply here and available. And a lot of it is when they are in the clinic, when their provider, when their CHW, when the nurse, when the pharmacist is encouraging them to go ahead and get their flu shot, then that's the opportunity. And if we don't have it in stock or inventory, then we've missed that opportunity. So the flu vaccines that we have given, the top bar is what our patient panel looks like currently. We have 47% or so, just under half, that are Caucasian. We have about 28% that are Hispanic, and another 24% that are African American, and just a few others that are Asian. That would be primarily Vietnamese. In the vaccine rate, though, of the vaccines that we have given, we've had much better success with our Hispanic population, and not as good a success on nearly half in our white population, and significantly less in our African American population. I think, again, that reflects on the trust, the relationship, when their doctor or their nurse is recommending. I think the trust is established with many of our Hispanic patients with language and just familiarity that they do get their vaccine. What we've done specifically and what the components of our program are, we do get the free flu vaccine from the health department. We also have the partnership with Walgreens and Americares for vouchers that they will come on site and do vaccination clinics. All of our providers are now encouraging and recommending the vaccines that are appropriate, whether it's, and we don't yet have the new COVID booster shot, but we have had COVID vaccines in the past. We have flu, we have pneumonia. We do not have RSV yet. The volunteer medical director also established standing orders for the RNs to give flu shots. So if the patient indicated that they wanted to get that, we could go ahead and initiate that while they were here and while they were waiting for their provider. And since we have implemented Epic, that is one of the care gaps that's flagged, so that if they have not had a flu shot, that does come up on that patient snapshot, and hopefully the provider will address that and provide that to them. We have done quite a bit of social media about flu and vaccines. We have signs up in the clinic when we have vaccine available in English and in Spanish to encourage patients to ask their nurse or ask the pharmacist. The entire team is aware of the initiative to support flu vaccines, and we did have our providers last year wearing this Ask Me name badge about vaccines. Love yourself, the world, and your family. Ask me about vaccines. And that is my information. So if there are questions or follow-up, I'm certainly available.
Thank you so much, Susie. We'll hold questions to the end. We already have some in the Q&A. Folks, please do put your questions in. I want to turn to Dr. Latressa Gordon next to talk about her efforts.
Good afternoon, everyone. Thank you for having me on this wonderful platform. My name is Dr. Latressa Gordon. I'm a U.S. Army veteran and have been a nurse for over 33 years. Currently, I am with Michigan United, the Director of Public Health Nursing and Navigator Program. This program started in 2020, but Michigan United has this statewide. It's a grassroots organization, and it focuses on social justice and dignity, environmental justice, immigrant rights. The health team was developed in 2020. Pastor Monica Varela, Aurora Sacita developed the Public Health Navigator Program, and I came in. During 2020, on the height of the pandemic, 13 to 14 navigators were picked trusted members of the community, trusted voices. And during that time, we would go out and educate the community, creating that safe space for our community members to answer questions, provide information. We often called ourselves the Mythbusters for COVID, providing hand sanitizer and masks. And then, like in 2019, when the vaccine, 2021 February, when the vaccination became available, we were able to partner. We have like over 30 community partners. We partnered with MTA to eliminate the barriers, addressing all social determinants of health, providing rides to vaccinations, scheduling vaccinations. And then in 2021, June, the development of the nursing program, where we were able to partner with the Genesee County Health Department, that's also with the Navigator program, which is unique. Dr. Pamela Hacker, who is the medical director of the health department, partnered with Michigan United, and we created the program where I was able to have access to the COVID-19 vaccination and actually do pop-up clinics throughout the community, eliminate the barrier of access. So we did vaccine equity that way. So there's a team of 13 nurses. We partner with local hospitals, other health plans to provide the vaccinations and education. One of the things is the health literacy piece. Once we got out there in the community, like I said, we're trusted messengers. So that's one way that we were able to get into the community and provide the correct information, get rid of the disinformation and misinformation in our community, but providing that safe space where our community members can come and they can ask all questions without being judged. That helped us to build trust by being visible and consistent. So once that we said that we would be here, we do 25 to 30 events a month with COVID and flu. We're also a part of the NICE grant with the CDC to provide equity for adult vaccines and flu. So our plan, we partner with local pharmacies. We have Walgreens, we have Big Brothers and Clio, and we go to nursing homes. We've gone to bars, we've gone to strip clubs. So there's no place that we haven't gone. And we also have implemented a home vaccination program for those that were afraid to come out in the clinic. And we did all this in the midst of the pandemic, boots to the ground, service work, face to face. So we did home visits, taking vaccinations, flu, COVID vaccinations in homes, in our churches, the faith-based organizations. The infrastructure was already set because of the pandemic, before the pandemic with the water crisis. So the faith-based had a task force. So we connected with local churches to host vaccination clinics, information sessions, senior centers, schools. So we cover a vast variety of grounds in providing access to vaccines. So that's one of our successful things, is being able to go in the community, because I grew up in the community, we're part of the community. So we had already in place infrastructure, individuals that were already doing work in the community, already trusted voices in the community, and creating that safe space and access. That's the main base, is to create the access to the program. That's basically what we do in our community. We are implementing flu vaccines. We have over 5 standing sites, and we continue to do pop-up clinics throughout Genesee County and Oakland County. And that's kind of the gist of the work that we have been doing over the past years. And we also implemented, once we were out there, we found that people were having other issues like, what can I do? My water is, I have bad water. Can you connect me to other water resources? I need milk for diapers or things like that. So we had to address the basic needs, the social determinants of health while we're out there doing the vaccinations. So we also initiated a blood pressure clinic, partnering with Hurley Medical Center and Nurse Tarnisha Martin, where we would provide not only the education for blood pressures, but we provide blood pressure cuffs and training and the follow-up. And we also do the follow-up with the vaccinations as well. If they have questions at the vaccine site and they're not sure, we provide them with all the information and our contact information and let them contact us. And like I said, we will bring the vaccination to them. So that's one of the main things, is just having that access piece and being a trusted messenger. That's one of our success in the program that we have initiated. Anybody have any questions?
I thank you. We do have some questions, Latressa, but we'll go on and we'll let Gina talk. And I have some questions too for you. So thank you. And Gina, can you share with the group kind of your program and what you all are doing?
Yeah, thank you so much for having me. My name's Gina Grumble. I am a pharmacist and a grant writer for Helping Hands Health and Wellness Center. We are a free clinic that's located in Columbus, Ohio. I've been with the clinic on staff since August, so I'm very new to the clinic and starting to implement a lot of things on the pharmacy side. But I've volunteered as a pharmacist in the clinic for 4 years, so I'm very familiar with their processes and their history. So we are a 501c nonprofit organization. We opened in 2009, and we're a faith-based free medical clinic that serves only adults, so anybody over the age of 18. We serve uninsured or underinsured patients that are below 400% of the federal poverty level. To give you a better idea of the patients that we serve, about 90% are uninsured. So we are seeing mainly the uninsured population, as well as we have a very high population of immigrants and of Black patients. Many of our patients that we get, we see through the community, just spreading the word about our clinic, and that's mainly our main source of advertising our services to the community. We provide a free care program twice a week. So we have a program on Tuesday mornings and a program on Thursday evenings. During the program, we offer family medicine services and social services at no cost to the patient. We also have a pharmacy access program in which I'm over that operates during the free care program. So during the program, I'm able to provide medication histories to all of our patients. So we get a good medication background before providers see that patient. And we also provide patients with 1 month supplies of medications that I have on formulary, as well as prescriptions that they can get in outside community pharmacies. We do all the counseling of the medications, and we also help patients develop plans to secure long-term solutions to obtaining their medications. So this includes our partnership with a charitable pharmacy that's local that patients can go to get free medications long-term, as well as obtaining medication assistance programs for more expensive medications or brand name only medications. We are a volunteer-based clinic, so all of our providers are volunteer. We have a small staff of about six of us that work part-time, and we see about 20 to 30 patients a week. Last year, we saw a total of 724 unique patients with 1,036 visits. So we are a pretty small clinic still, and just offering those 2 free care programs on Tuesday mornings and Thursday afternoons. In addition to our free care program, we also offer a women's health program. So this allows women to get appropriate cancer screening. So we have free pelvic exams, clinical breast exams, and pap smears. And we're also able to refer them for mammograms if appropriate. We also do physical exams for work or school, vision screenings, tuberculosis tests, and other counselor services. So we are in our very initial stages of introducing a vaccine program, and I am leading that program. Last year was the first year that we offered flu shots for our patients. We were able to get flu shots through direct relief. And if you're not familiar with direct relief, it's a nonprofit organization that helps people that are in poverty or people that are in emergency situations like natural disasters. So they offer medications to local free clinics free of cost to be able to provide medications to patients. And we were able to get a small quantity of flu shots last year, and it was probably around the end of December, early January, so very late in the season. But out of those flu shots, we gave 23 shots to patients. So we were still able to vaccinate our patients at that time. This year, since I started in August, I did try to get a grant for flu vaccines, but I was unable to do that late in the game. I also reached out to the local health department, and we were unable to get vaccines from them as well. So options for our patients at that time when I started was we could refer them to the local health department and they could go there. However, transportation is a large barrier for many of our patients, so it is difficult for them to get transportation to our local health department from where they live. So those are our options. At that time, I was able to partner with Walgreens, Americare's flu vaccine program, and was able to send our patients to Walgreens. Again, as I said, transportation can be a barrier for our patients, but the Walgreens that we have closest to our clinic is less than 10 minutes away, so we were able to partner with them to provide free flu and COVID vaccines. I'm still waiting on the numbers from Walgreens to see how many of our patients were able to participate in that. We advertise each clinic through providing patients with paperwork. So they have a paperwork folder that they get every clinic, and we just added some advertisement for this program and had the nurses talk to the patients a little bit about the program and how they could get vaccinated through Walgreens. Then in about November, mid-November, I was reached out to by one of our local organizations called Life Care Alliance. Life Care Alliance is a nonprofit human services organization that helps people with a wide array of different health and nutrition services throughout Central Ohio. So they reached out and said that they had extra flu vaccines. So it was really lucky, and we were in the right spot that I was able to get some vaccines from Life Care Alliance, and we started vaccinating our patients late November. Throughout this time, up to date, we've vaccinated about 30 patients, which is a great number for us considering how small of a clinic we are. So I'm doing about a quarter to a half of every patient of our patient group that's coming each free care program. The way that we are advertising is we're having our nursing staff answering triage. So our nursing staff consists of nurses that volunteer, a nurse that we have on staff, as well as nursing students. And so they educate and ask the patient during triage if they're interested in getting their flu vaccine. And we have a standing order with our provider that a nurse or a pharmacist or a pharmacy student can provide the vaccine for the patient. So I am partnering with the nursing staff to provide vaccines throughout the clinic day. We find that generally our patients are open to getting the flu vaccine. Even though it's January, we're still vaccinating at a very high rate. Last night was Thursday, and I think we did about half of our patients were interested in getting flu vaccines. So we're still able to vaccinate at a high rate. We're finding that our patients are interested in getting a flu vaccine, but they just are not able to navigate getting that elsewhere. They're not able to pay for a flu vaccine at a pharmacy where it may be $40 to $60. And so they're very open to it. They just don't know how to navigate outside of the clinic on how to get a flu vaccine. My goals for next year is to develop a grant to be able to get flu vaccines at our organization earlier in the flu season, because I think we can be very successful in providing flu vaccines. I've also developed a partnership with Life Care Alliance through getting the vaccine from them, and I'm able to see how they got vaccine, and we're talking through that as well as increasing availability of other vaccines through grants. So really beefing up our vaccine program that we have right now. So I'm looking to provide other vaccines, especially for our immigrant population, in which they may need a lot of vaccines and are unable to get it elsewhere. Thank you for your time, and I think we can open it up for questions.
Thank you so much. What so you all are doing some pretty amazing work. I wonder, Latressa, if you could come back on the screen. I'm going to start with some questions that maybe the three of you could kind of talk amongst yourself. And there was a question actually from one of our participants or attendees of how you build trust. That seems to be a very important issue that the three of you, and I think you, Dr. Gordon, especially addressed this in your comments. So how do you build trust with the patient populations?
First of all, in our community, we service the underserved Black and Brown community. We have a interpreter, so we make sure we have all current literature. We're culturally sensitive, and removing all biases that we have. So when we go in the community, we don't go in there like we're going to tell you what you're going to do, or we have all the answers. We're transparent. So we create that relationship where it's a two-way communication, where I have this information. Okay, what do you need to know? Well, we had at one time at a clinic, we have a gentleman came up and say, well, I heard if you take the vaccination, it'll turn you into a moth. And, you can start hearing radio. So as that sounded, I'm talking to them like, that is a valid concern. So I told them there's no question or anything. You can ask us anything. So we have like a team of 14 nurses with over 200 years of experience. And also like our navigators are highly, educated to train. So when we go on the space, we don't go in there like we own it. We go in there, this is, your space. And plus I grew up in the area that I serve. So I know the ins and the outs of where I serve, but that doesn't give me, just because I go in there with the vaccine credibility. Like I say, the health department, I'm also dual employed with the Genesee County Health Department. So I have 24-hour access to the vaccines, also literature. We have a faith subcommittee that we developed. That health literacy piece is the biggest thing. Going in and teaching our patients to advocate for themselves. So when we go in there, we have that mutual respect. We have the two-way communication, and it's a safe space. So when you come in this space, when you come to our clinic, we have a navigator table with all our information that we like to disseminate and pass out, and they're able to ask the questions to the navigators. And if the navigators do not have an answer, then we have the nurses, the team set up for the nurses, where we do our own we were able to do our own vaccinations with the team. So we just have that conversation, just like I'm talking to you right now. There's like that dialogue and being visible, and also being consistent. So if I said that I'm going to be at this clinic on Tuesday, I'm at that clinic on Tuesday. If our team say you can call us with any questions, we answer the questions, and build that way. Consistency and visibility is one of the things that our team member has done.
That's great. Susie and Gina, your thoughts about that?
I would say from our perspective, a lot of the same concepts, certainly culturally sensitive and available. But the fact that they are established as a medical home here, they do develop that relationship. The front desk knows who they are and ask about their kids. And the nurses say, well, it looks like you've lost some weight since last visit. There's a real feeling of concern and caring. And that's not something that our patients have always just naturally had in their encounters within the healthcare system. I think we also try to take a little bit different approach to encouraging adherence to recommendations. Not so much a lecture teaching, you should, you must, but more of the coach aspect, the health coach concept, because just labeling someone as non-compliant is easy to do, and saying they're not making good choices. Well, they're making the choices that they have sometimes, which are very limited frequently. And they looking at it as they are not yet engaged in their own health maintenance as we would like. Rather than they're not doing what I told them to do. So it's just a different kind of relationship, and the relationship builds the trust.
Gina, how about you in your short time at your clinic?
Yes, I would definitely agree with what everybody has said so far. So for us, it's really building rapport within our community, and we do that by going out. We're in the community doing fairs and things like that, and really finding out what the needs of the community are instead of, thinking what we think the needs of the community are and then trying to fix those needs. So really going out and finding what the needs of our patients are, and then the patients talk to their friends and their family, and that's how we build rapport in the community that we're in. Additionally, as a pharmacist, I am really meeting the patients where they are. So a lot of times patients might not be adherent to their medications. There's probably a reason behind that, and trying to figure that out and find solutions for them for long term on how they can get their medication. Even if it, thinking it may not be expensive for me or you, that could be a meal for somebody, and they may choose a meal over getting their medications for the month, and finding out solutions for them to get their medications that they need. A lot of our patients treat us like a hospital. They are coming to us for all of their needs. And so we are, instead of referring them to the emergency room, like they came to us, and we're trying to meet their needs as much as possible.
That's a very interesting point. I want to ask about, it seemed that all of you made mention of the lengths you have to go to get vaccines. And I wonder if you all can talk about that a little bit more, and what you would like to see to help you be able to get vaccines that, so you could get it to all of your patients.
Yeah, we've had a long-standing relationship with our health department for flu vaccine. We are working with them now as the states are administering the COVID vaccine and boosters. We were directly registered with CDC, and in April of 2021 started giving COVID vaccines. There is a lot of vaccine hesitancy in general in South Carolina. There, it had become such a political issue with the COVID vaccinations that I think has carried over to some of these others. But source-wise, in addition to the health department, some of our partners, Direct Relief, Americares, Merck, some of the pharmaceutical suppliers do make vaccines available. That's how we get our Pneumovax, is from Merck. We get Prevnar 13 from Pfizer. We have had Tdap in the past. We'd love to be able to access that more regularly. We would love to get Shingrix for our over 60 and RSV, but we have not yet. Maybe they're too new to be made available to the free clinic systems, but there are lots of partners that are helping safety net providers to access vaccines as well as other medications.
Latressa or Gina, do you have anything to add?
For us, like with the COVID vaccinations, as I stated previously, being dually employed with the Genesee County Health Department and that partnership, I was able to have direct access, like say 24 hours access to the COVID-19 vaccination. Now shifting when we came out with the new vaccine, the changes with the CDC, the Bridge program, that kind of put a halt on how we were able to handle it. So that's how we we're able to connect with Minority Quality Forum and Center for Sustainable Health and Quality Equity and partner with Walgreens to provide flu vaccines, COVID vaccines, and shingle and RSV and pneumonia, and also with our other local pharmacists that are able to come out and to provide those vaccinations. So currently we have the connection with the pharmacy. We have the clinics that are standing, the events that are currently coming. Like I said, we do between 25 and 30 events a month. And say recently, so we had, probably like 120 COVID and flu vaccines in Oakland County. In our last couple of clinics, we've been doing between 25, 17, and 20 vaccinations. And we kind of partner those with events like giveaways. We had one at a local churches that they do with food, water, clothing. Like I say, meeting those other social determinants of health. And while they're there, offer them the access where if they don't have the transportation to get the vaccine. So now they're at this central location and they have the vaccinations, making it convenient and accessible.
That's great. Gina, do you have something to offer about actually getting vaccines? You noted that in your comments.
Yeah, I am still navigating through the best way to do that with our clinic. I've had offers of our local health department coming to our clinic, but it's difficult when we see 10 to 15 patients during a clinic day for somebody to come and it be worthwhile. So still navigating through that a little bit on how that works best for our clinic, because what would be best if I can get vaccines and get it earlier. So I am exploring especially local grants that may not be specific to flu vaccines, but may support as getting flu vaccines from a provider.
There was one question that asked about the Vaccine for Children program, and I presume that those of you serving children can use that program for vaccines. Is that true?
Yes.
I think that, yeah, I think it is true. We don't see children. Our patients are generally 18 to 64.
And Latressa, you were saying?
Just with the health department, we have that program for the children vaccination.
So let's talk about the 29 to 55-year-olds who are just lamentably low vaccination. What do you think can help really get the message across or help these folks realize the benefit of vaccines? Do you have any ideas?
Well, currently I use like my social media, like TikTok, and put information on there, make it kind of fun. So I'm kind of having some little success doing like social media, TikTok. We also have helped develop with innovative solutions, a portal that like a COVID, Genesee County COVID portal, where they can go on there. It's the all access. So once they go there, they have access to where you can get your vaccine at, where you can get food at, where you can get insurance at. So kind of putting that helping get those health disparities and that lumped in into that one thing, that portal. So we use technology. Like I say, we go to Porch Fest, fun events with the youth that's involved. So they'll have like, a dance event, a family reunion type event. So we kind of, immerse ourselves in those events, and also like members on our team are in that age group. So they're able to talk to their friends and also keep that messaging current. Like so each person on that, each person will need a different technique, so whenever we're there, we're able to make a metaphor to that situation and kind of, they could connect with them that way.
Go ahead. Any other thoughts about well, I'm over that age, but for the recalcitrant adults? Gina?
So we have a lot of volunteers and a lot of students at our clinic, and what we did was kind of make a script for a lot of misconceptions, especially for the COVID vaccine, especially when it first came out. So we kind of had a lot of the misconceptions on there. So whenever a student or volunteer was talking to a patient and recommending a vaccine that they get, and we could talk a little bit about the misconceptions. That's mainly what we see in our neighborhood, and maybe what you commonly see in other neighborhoods is misconceptions, and then people talking to other people about the misconceptions, and that's how they spread the most easily. So coming from a healthcare professional, addressing that, again, taking it seriously, and just having like a one-on-one conversation with patients.
Yeah, it seems to come from just making sure there's accurate information. And a lot of times asking if they would consider getting the flu shot opens the door. Having that conversation lets you have some feedback from them. Well, I've heard you get the flu if you get the flu shot. That's the opportunity to then correct that information and point out what the risks are. And at different points is where that can occur within the clinic, which is why it's just so critical to have the diabetic educator and the nurse and the pharmacist and the CHW all on the same page and encouraging that and opening the door for the conversation to clear up those misconceptions.
I love that you talked about the whole team being on the same page. We had a couple of questions about how do you assess literacy and social determinants of health needs, and included in those questions was, does EPIC help you with that? So if you all would address that.
EPIC does have a social determinant screening tool, and we are working very diligently to do those assessments because it will indicate what areas are the biggest barriers for some of our patients. When we had a paper chart system, we had a queue on the chart if someone had difficulty reading. We don't have that in EPIC now, and it is a challenge. And we made the mistake early on that assuming that we had all of our materials available in Spanish would be addressing the information need of all of our Spanish speaking patients. Well, two parts of that is Hispanics are illiterate at the same level or perhaps higher as English speakers, and just having Spanish materials doesn't mean that it still is accessible. And then also the dialects and the understanding that's a challenge, that Spanish is not Spanish. So realizing that in our area, we have a lot of Colombian immigrants, we have a lot of Mexican immigrants, we have certainly a lot from Central America, and there's apparently quite a few different dialects from Central America. So there are challenges in that, and we don't really have good ways except to kind of be on the lookout, know some of the cues that patients use, kind of those excuses that might indicate that they are not able to be fully literate and read materials.
We have a question for you, Latressa, about how you identify and come to connect with folks in the community and organizations in the community. And I guess I would throw this to all of you because there was a question about mobile clinics. So how do you identify and secure partnerships in the community?
I feel like before, like we have like over 25 to 30, because I always say, this is my saying, it takes a village to raise a child. It takes a community to raise a community. So we can't do this work alone. So we have over 25 to 30 partners in the community. And before the vaccination came out for COVID, we had started the groundwork, the boots to the ground, going to the doors, handing out the flyers, going to being invited to these different events. So they got to know us with our blue shirts, Michigan United, out there in the street. That's how we got trusted. So when the vaccination clinic, time rolled out, we do, like I say, the mobile clinics popping up outside, picnics. We've been to family reunions. And so we're invited to these events. We create these events. We partner, like I say, with Hurley Medical Center, a patient resource advocate and assistant nursing director, Tarnisa Meyer and Tanya Battle. Some other in Michigan United already have these connections in place. And like I say, the local churches were really instrumental in providing safe spaces for vaccination clinics and education. And I saw a question also about how do we assess the patient or our community members' literacy. It's like the continued education is, I see in there, my assistant director, continued education, and that teach back, so we're out there. And my doctor, they'll bring, like I say, there's everything, social determinants of health. There's a sheet that you can fill out for them. Ask them, are you concerned about your water? Do you have transportation? How about your medication regime? We found a lot of people when we just started doing blood pressure checks. Out of 100 people in the room, 85 to 90 other people, blood pressure was severely elevated. So also,
right.
to navigate the healthcare system. When to go to the urgent care? When do I go to ER? When do I go to the PCP? So those are some of the things that we utilize already. Those standing foot groundwork that we had established for those clinics. So we have standing clinics, and we also continually go to pop-up events and just events that you wouldn't expect to have a health event at. We're there. So we're pretty much, anybody call us, we're there to offer education, to offer vaccinations. Like I said before, one of the biggest things is that home visit program that working with the Genesee County Health Department, being able to go into people's homes where I didn't feel safe because I thought I might get COVID or the flu is out, RSV is up. Can you come into my home and bring the vaccination? So just meeting people where they are and assessing the need. And like we say, instead of bridging the gaps, we're filling the gaps.
You know, we are at 1 o'clock and I hate that we're done because I have more questions, but I want to respect everyone's time as we head into our long weekend. I can't thank you enough for what you do and how you've shared your wisdom today. I wonder if any of you would be willing to share with us kind of your assessment sheets. You just talked about some, Latressa, that you use that maybe we could make available to others if that's okay with your organization. And maybe we can have you back next year and see how it's going. How about that?
Thank you.
Sure.
Oh, you guys are great. I wish everyone on the call a great weekend. I say thank you to everyone and go Steelers. Okay, I had to say that. All right. Thank you.
Thank you.